Welcome back to the Motivated Mind Zone. Glad to have you here. Okay,
Okay.
let's unpack this. Our sources today, they're pulling back the curtain on Hollywood medicine. We're focusing specifically on The Good Doctor,
Yeah.
the hit show.
Right. And we've got this really fascinating critique from a practicing doctor who actually sat down and watched the early episodes, trying to figure out what's real surgery and what's just, well, cinema.
Exactly. So that's our mission today. Give you the shortcut to understanding the medical facts, the anatomy bits, and the professional conduct side of things, all from this expert review.
Yeah, we need to sort out what the main character, Dr. Sean Murphy, he's the surgical resident with Savant syndrome, what he gets medically precise versus what's stretched into like superhuman territory for drama.
We're looking at tricky diagnoses, the rules for emergency first aid, hospital conduct, that kind of thing.
And I guess the big question is, does that near-perfect memory and amazing visual analysis actually make a better surgeon in reality?
Or is it just a handy plot device?
It's interesting, isn't it, how shows sometimes nail the basic survival stuff, and then later they just throw reality out the window for a hero moment.
Okay, let's start with that first emergency scene in the source material.
Yeah.
The kid's injured in an accident. Before all the big drama, the doctor reviewing was genuinely impressed by something small.
What was that?
Dr. Murphy's, and I quote, excellent technique of washing hands.
Huh. Sounds simple, right? But hygiene is everything, even when things are chaotic like that.
Absolutely. And the immediate call to 911, that's obviously the right first step, always.
But the critique really honed in on something else. Dr. Murphy quickly spotting the damaged jugular vein. That speed, that accuracy, and that kind of high-stress moment. The reviewer found that genuinely stunning.
Right, that's the savant analysis kicking in, I suppose. But seeing the wound is only step one, isn't it?
Yeah, step 2 is pressure. First rule of trauma. Strong pressure to stop the bleed.
But the source pointed out a really big risk when doing that on a child's neck.
This is critical and often missed. On an adult, you apply strong, continuous pressure to that bleeding jugular. Life-saving. But with a child, their trachea, their windpipe, it's smaller, less rigid compared to their neck size.
Ah, okay.
So if you pushed hard enough to stop that vein bleeding, you could easily accidentally compress the trachea.
So you stop the bleeding, but then the child can't breathe? That's tricky.
It's exactly that. A
Yeah.
tightrope walk, trading one massive danger for another. The reviewer noted a real doctor needs careful, localized pressure and has to be constantly checking the child's breathing. The show actually got that risk across, which is good.
Okay, that makes sense. And that leads to the next big first aid rule the show got right. Foreign objects,
Yeah.
like glass or maybe a knife stuck in a wound. What's the absolute rule there?
The solid, universal advice, and this is for everyone listening, is never, ever remove an object stuck in a wound yourself.
That feels so wrong, though. Wouldn't you want to get it out?
Yeah.
Infection, pain.
I get why you'd think that, but it's basic physics, really. In most serious penetrating injuries, the object itself, the glass, the nail, whatever, it's actually doing a vital job. It's plugging the hole. It's putting direct pressure inside on the damaged artery or vein.
Ah, I see.
Pull it out, and you release that pressure instantly. The person could go from critical but sort of stable to bleeding out catastrophically in seconds.
Wow. Okay, so the rule is stabilize it, put pressure around it, call for help, and let the pros handle removal in the hospital.
Exactly. Don't wiggle it, don't pull it, stabilize and wait for paramedics or the ER.
Okay, let's shift gears now from the roadside chaos where survival rules to the hospital, which, looks sterile but has its own kind of chaos.
Oh, yeah.
Politics.
Oh, yeah?
The sources said the bureaucracy, the pressure from hospital presidents, staff, shareholders, that's all very realistic.
Absolutely true to life. Residents, attendings, they're all under huge non-medical pressure. Budgets, patient numbers, internal politics, it affects everything. It's a business.
Mm-hmm. And, of course, it wouldn't be a medical drama without relationship drama. Specifically, the review mentioned the big drama around sexual relationships between residents. Why flag that?
Well, the sources confirmed that, yeah, residents might end up sharing sleeping quarters sometimes just due to lack of space and pure exhaustion. Seeing a male and female doctor crash out in the same room isn't necessarily scandalous, but actual sexual relationships, that's explicitly problematic. It's about the power dynamics.
Because residency is so hierarchical between residents, supervisors, attendings.
Precisely. Introduce sex into that strict structure, and it just messes everything up. Professional objectivity goes out the window. You get favoritism issues, potential HR nightmares, misconduct claims. So the reviewer confirmed, yeah, the big drama on TV.
Okay.
It's based on very real problems these relationships cause in that kind of high-stakes environment.
Okay, this is where it gets really compelling for me. Dr. Murphy's specific skills from Savant syndrome, that near-perfect memory, the genius-level analysis, the spatial reasoning. How valuable are those actually in surgery?
Oh, monumentally valuable. I mean, think about it. Surgery is fundamentally spatial and memory-based. Knowing anatomy perfectly, the path of every single nerve and vessel, crucial. Spatial thinking to navigate inside the body, essential.
And the patient's usually unconscious, so.
Right. So those cognitive skills often matter more in the OR than smooth talking or bedside manner. The hospital president valuing his skills over his social awkwardness. That actually makes sense from a purely surgical standpoint, according to the source.
But the show does also show the communication difficulties with autism. Did the review comment on the realism there?
Yeah, it did. The lack of eye contact, the trouble reading social cues, those are portrayed accurately as classic indicators. And the show kind of hints at early intervention programs where people learn to consciously copy social behaviors, use scripts to make interactions seem, quote, more normal.
Like an intellectual approach to social skills.
Exactly. And there was that one quite specific detail mentioned, almost heartwarming.
About childhood development.
Yes, the source mentioned studies showing that individuals with autism who grew up with pets often showed better communication and relationship skills later on.
Really? Pets?
Yeah, it suggests maybe pets offer a sort of bridge for emotional connection, maybe less complex than human interaction. It's a small thing, but it adds a touch of real-world nuance.
Now, we have to talk about the superhuman stuff, the instant diagnosis power.
Yeah.
There's that scene, right? Dr. Murphy spots this tiny, critical change on the boy's ECG that 4 other doctors totally missed.
Yep. Sees a slight drop in amplitude, pulse steady at 86.
And the reviewer said,
Basically, that's where we jump into TV magic. Look, a savant's memory and visual skills are incredible, no doubt.
Yeah.
But reading an ECG properly, it's meticulous. You use calipers, you look carefully at the paper printout, you track changes over time.
you don't just glance at a monitor in a busy corridor.
And instantly see a micro change that 4 trained doctors missed.
Oh.
No, that's not how it works.
Okay, so how long would it take a real team, realistically, to spot that?
If they were really focused, using the right tools, maybe 5 minutes. A dedicated review. The show crunches that down to like a second for dramatic effect. It establishes his genius, sure, but it's a plot necessity, not reality. Genius versus plot device, you know?
Right, and the condition he diagnosed from that tiny visual cue was?
Pericardial effusion, which was quickly becoming cardiac tamponade.
Can you break that down?
Sure. Think of your heart like a pump inside a bag. The pericardium, effusion means fluid, usually blood after trauma, is filling up that bag. Tamponade is when there's so much fluid it starts squeezing the heart itself, strangling it, basically.
Right.
The heart can't expand fully to refill with blood, so the amount of blood it pumps out drops drastically. Very dangerous.
Okay, wow. Let's move to maybe the most intense moment that improvised airport surgery. He makes another diagnosis first, right?
Yes. He sees the swollen veins in the arm's venous distension. He knows that means huge pressure built up inside the chest. That's the classic sign of a tension pneumothorax. A collapsed lung where trapped air is crushing everything in the other lung, the big blood vessels, the heart.
And the only fix is immediate decompression, letting that air out right there.
Right there. And yeah, the shopping list for tools is memorable.
A blade over 12 centimeters, a long, narrow tube from a soda machine.
Duty-free gym beam for antiseptic, gloves, duct tape. Yeah.
It sounds absurd. But the source said the technique was actually good.
Surprisingly, yes, the technical part. When you insert a chest tube or needle for decompression, you have to find a specific landmark. the mid-axillary line.
Middle of the armpit.
Exactly. It's the safest spot to avoid hitting the heart, major vessels, nerves, he did that correctly, and using water in a bottle as a one-way valve. So air gets out but can't get back in. That's standard procedure, makeshift or not.
Incredible precision with, well, whiskey and duct tape.
Well, speaking of sterile, that brought up the one really gross detail the reviewer flagged.
What was that?
Blowing into the glove to inflate it.
Oh, yeah, okay.
The reviewer basically said, no, the human mouth has a ton of bacteria. Blowing that onto a glove you're about to use near an open wound, that's just not sterile at all. Even perfect memory can't change basic microbiology.
Right. So despite the technical skill, despite saving the kid's life, Adam, this raises the massive ethical issue, the legal gray zone.
Absolutely. He saved the life, but with makeshift tools in public.
How does that square with something like the Good Samaritan law?
That's the core conflict, isn't it? Good Samaritan laws usually protect people giving basic aid, CPR, pulling someone from a fire. But does that protection cover performing a complex, invasive procedure like putting in a chest tube with a soda machine tube? That's surgery, essentially.
So where's the line between helping and unauthorized, risky medical practice?
The source really emphasized this. Even though it worked doing specialized medicine way outside a hospital, non-sterile, it could easily be seen as reckless, an abuse of trust. The positive outcome doesn't just erase the huge legal risk he took. The show acknowledges that later with the hospital review, which is realistic.
It forces you to ask if those laws even work for highly skilled professionals in emergencies. Save the life, risk your career.
That's the dilemma. It pushes way beyond simple ethics into professional responsibility and legal jeopardy.
It really does. Forces the viewer to think about the real cost of being a hero.
Definitely.
So let's pull it all together. The final verdict on The Good Doctor, according to the source.
Overall, pretty positive, actually. The doctor reviewing felt it was medically accurate enough to be believable, and obviously the drama hooks you in, and there was appreciation for how it showed the struggles of living with autism, the family stuff, bullying, coping. It added depth.
But the main sticking point comes back to Dr. Murphy himself, doesn't it?
Yeah. He's written as a superhuman savant. That instant ECG diagnosis, that's pure television. Even for a genius, it just doesn't happen like that. They needed a character whose brilliance solves plot problems instantly. Necessary for the show's pace, maybe, but not reality.
Okay, so what does this all mean for you, our listener? You've basically got a framework now for watching these medical dramas. Next time you're watching, look for the correct first aid basics. Call 911, apply pressure, don't pull out foreign objects, appreciate the surgical know-how they sometimes show.
But remember that perfect memory plus instant diagnosis usually equals TV magic for plot speed.
We've covered a lot: basic trauma, the risks with kids' anatomy, chest decompression techniques like the mid-axillary line, hospital politics.
And the complex portrayal of autism alongside those savant skills.
And yeah, Dr. Murphy saved Adam's life from that pneumothorax, a huge medical win.
But the big question we leave you with is this. Does the success of that incredibly risky improvised surgery outside a hospital actually justify the legal and ethical tightrope you walked?
Or does the fact that it worked just distract from what could have been a massive professional disaster? A life saved, yes. But rules are definitely broken. Something to think about.
Absolutely. Stay curious, stay informed, and thanks for joining us on